Did you know that females have a 4 to 6 times greater chance of having a serious knee injury or tearing their ACLs more so than males? Did you know that 1 in every 100 high school female athletes tears their ACL every year? Did you know that 1 in every 1,000 collegiate athletes tears their ACL or has a serious knee injury every year? So now there has been a huge push towards injury prevention of these types of knee injuries. So I want to bring to you a simple test that you can do to see if you or your daughter or any of your family members are at risk for a serious knee injury. Okay? So this is called a step-down test. There's a lot of different ways to do this particular test, but there's a lot of different other types of tests that you can do to see if you're at a greater chance of a serious knee injury. Okay? So I'm just going to do this one because it's super simple, it's easy, and it's something that you can do on your own at home. Okay? So what we're going to do is a step down. So my hands are on my hips is how they recommend that you start this particular test. Your other foot's out in front of you here, and what you're going to do is all you're going to try to do is squat down and right back up. I'm going to show you this from the side as well. So you're here. What you're going to do is squat down and back up. Okay? Now, typically if you have any types of deficits in your lower extremity and you don't control that movement very well, then your body's going to try to compensate to try to help you out with that movement. So there's going to be 6 different compensations that we're going to score here. The lower the score, the better. All right? So 6 different movements. The first one, again, our hands are on our hips. As we start to squat down, if my hands come off of my hips to be able to try to balance, that's 1 point. If I try to squat down and my hip drops on this side here, see how my hip's wanting to go into this direction? That's 1 point. If I squat down and my knee caves in towards the other knee, that's 1 point. If my foot starts to compensate and it rolls to the outside, that's 1 point. If my hands are on my hip here and I try to squat down and my body, my trunk here, starts to compensate, that's 1 point. And finally, when I try to squat down and my whole body, I lose all my balance there, that's another point. So to be able to score this, 0 to 1 means you have good lower extremity control. That doesn't mean that if you have good control, then you're not going to have a serious knee injury or tear your ACL. It just shows that you have good lower extremity control and that you are less likely to. Okay? Now, if you score a 2 or a 3, you have fair lower extremity control, and that does increase your chance of having a serious knee injury or an ACL injury. And then if you score a 4, 5, or 6, that means you have poor lower extremity control, and that means that your chances increase even more. And that doesn't mean that you are going to tear your ACL by any means or have a serious knee injury, but it just shows that your chances do increase. So if you found that this test was helpful for you, or if you would like more information on serious knee injuries or the ACL, feel free to give us an email and let us know what it is exactly that you're looking for. Or if you would like a free report on ACL injuries, then email us or click on the link below and we'll be very happy to send out some more information for you.